All right, Dr. Brian McKay from Core Health Darien. I want to talk to you today about knee pain. Knee pain, you're over 50 years old, there's a good chance you have osteoarthritis of the knee. Well, it's kind of a fact of life. If you're active, you're probably going to have some kind of knee pain, and there's different ways to treat it. If you're, probably when you're in your 40s, you're going to do the Advil, Aleve, ice, rest, maybe a little bit of massage. But when that stops working, what tends to happen is you need more options. And one of the options today is viscosupplementation. Once again, viscosupplementation. And so what happens is the synovial fluid is that lubricant within the joint and lubricates the meniscus, which is like the disc between the femur and the tibia. When you have aging, you get wearing away of the meniscus and you have less production of synovial fluid. So what we can do these days is you can get these knee injections with the main component is hyaluronic acid. Once again, hyaluronic acid. And it comes from a natural source. It may not be good if you're a rooster because it's basically the top that comb on top of a rooster's head that has the high concentration of hyaluronic acid. And this is then broken down, purified, and then injected into the knee joint. And what it does is it's going to buy you several months. I mean, typically it's going to, the results vary. Okay. Sometimes you can have, results for up to 12, 15, 16, 17 months. Most cases, I think I've been seeing like 3 or 4 months, but say you're going on a cruise, or not today with this coronavirus, you don't be going on a cruise, but say you're going on a trip and you're going to be doing a lot of walking, or you're going, you want to have that knee pain. There's no reason not to get the shot. They're fairly safe. I mean, some people, some people have issues, but typically you can pretty much get the benefits are going to last, from a few days to more than 6 months. And one of it does is the factors that play a role is how long have you had the knee problem, how bad the knee problem is, how much damage to the knee. So everybody's a little bit different, but just so you know, the knee gel injection, and that's what they're called pretty much, as knee gel injections, and it gives you an idea. They are effective. It's typically it's for osteoarthritis, which just means, it becomes more painful and difficult to move your knee as you get older. You play around the tennis, you play, some golf, you're active, you want to go for runs, and you just start feeling that twinge in the hinge. Well, you're not getting any younger. Maybe you're getting prettier, but not any younger. And so, I mean, steroids have been used for a while. And the steroids, prednisone, a couple names, Kenalog, Tricean, Zilretta, they really don't, the short term, they can do some damage to the joints as well. You really only want to get a few of those, and most doctors only do 2, maybe 3, and that's about it. Even for like high level athletes, they really don't want to use steroids. It's a very stopgap, and it basically compromises your immune system as well. So the let's say Synvisc is one of the more popular. The other ones, Euflexa, Hyligan, SuperArts, Monovisc, Orthovisc, Gel One. These are the types of names of these hyaluronic derivatives, and basically it's a very thick. Visco is another term for thick, and what happens is you're injecting this into the joint space. And sometimes what the orthopedic will do is they're going to take out some of the fluid to make room for the hyaluronic acid or the visco supplement. So it's not a terribly painful type of thing, and sometimes you can feel they only take a few minutes to do, and yeah, he's going to put the needle in, and you might have just a Band-Aid, when you leave. And so sometimes, you got to take it easy for a few days after you get these shots. But for the most part, you got to know it does help, So the study has been showing is sometimes the Synvisc or the hyaluronic acid injections may take longer to provide relief, but the benefits are going to last a little bit longer. Okay, that's the idea, is they do last a little bit longer. It's not a permanent, it's not a permanent thing. Luckily enough, sometimes you can have a little flare up immediately after the injection. It's kind of rare, but it does happen. So the outlook is, if you're having chronic knee pain and you want to get over it, even for the short, listen, a little bit of relief is a good thing. And your stomach can only really take so much Advil or Aleve. So in that case, think about it. It's not the worst thing in the world to to go ahead. And what you have to think is the meniscus, the synovial fluid lubricates the meniscus. So if you I always use this analogy. If you have a sponge on the side of the sink, you go away for a few days, you come back, it's cracked, it's compressed, it's not as strong as it was. And so what happens is you put a little bit of water onto that sponge, and voila, you have spacing. It pops up, it's absorbent. And that's what you really want for the meniscus. But the synovial fluid in the joint is really the catalyst to keep that, cushiony absorbing of the shock and the weight, the weight of the body. So by injecting some of the hyaluronic acid, it's going to reduce the friction in the joint. Think of it as the joint's grease. It gives lubrication between the bone and the cartilage. And as the cartilage begins to wear away due to the aging process, and this is going to hit the people who are about 50 years old and above. All right, it's pretty much the 50-year-olds and above who are going to get nailed with this. So typically, you start to experience pain in the joint, tenderness, stiffness, loss of flexibility. And then over time, the symptoms are going to become severe. So the main thing you got to know is there's really no cure for osteoarthritis of the knees. And people who don't respond to exercise, physical therapy, and weight loss to reduce the pain inflammation, Viscosupplements are definitely something worth considering. And in many cases, insurance is going to cover it if you have insurance these days. You know how that goes. But it's becoming more and more popular. It's just something to think about because you want to stay active. You don't stay active. If you're like me, you get cranky. You can't get to the gym. You get cranky. You can't run. You get cranky. You can't go play golf, tennis. It's about doing the things you love to do without having those restrictions like you did 20, 30 years ago. And so, as we get older, there's less levels of hyaluronic acid in our synovial fluid. By injecting it, you're increasing the concentration of hyaluronic acid, which then helps the cartilage stay nice and lubricated. It kind of prevents the cartilage and the bone from grinding together and causing more damage, which will ultimately lead to a knee replacement. Let's face it, we all know people have had knee replacements. Thank God they exist because they're going to help us, stay active even longer. So the thing was, it was kind of odd. It's like I said, they come from the sterilized rooster combs. That's the fleshy top on the rooster's head that give it that funny look. Like I remember Foghorn T. Leghorn from Bugs Bunny days, had that red comb on top of his hair. The only people who really couldn't go for this are the people who have, if you're allergic to chicken, poultry, and eggs, you're probably not going to do this. It's an allergen. So it's really ideal. Viscosupplementation of the hyaluronic acid is ideal for people who have mild to moderate osteoarthritis of the knee. And if you've tried the other things, you've got nothing to lose in terms of it. So I would say give it a shot. Your orthopedic is the guy to see on this one. I'm a chiropractor. We do have knee therapy that we do, but we don't do injections here. And I think you'd be pretty pleased with the results. And you know what? Let me know because stuff like this happens. Basically, and I have knee problems as well. So will I be looking to do this injections? At some point I can see that happening. But I'm Dr. Brian McKay at Core Health in Darien. You have any questions? 203-656-3636, 203-656-3636. Thanks for listening.